You've done this procedure 217 times. You're not counting anymore. You stop counting around number 50. Your hands know the steps before your brain does. That's what 14 years feels like. It feels like not having to think. That's the problem. It's a Tuesday morning. The OR is cold and bright and quiet, just the way you like it. The patient is already on the table. 53 years old, father of two. His name is on the chart. You stopped reading names years ago. It makes things cleaner. Your resident hands you the scalpel, and you begin. 40 minutes in, something feels different. You don't say it out loud. You never say it out loud. That's not how surgeons work. You just feel it. A small shift in the tissue. A detail that doesn't match. You make a decision. It takes 3 seconds. 3 seconds. You'll replay those 3 seconds 10,000 times before the year is over. The alarm sounds before you finish the sentence you're saying to your resident. High-pitched, steady. The kind of sound that clears your head of everything else. Blood pressure dropping. Fast. Too fast. You call for more units. You work faster. The room fills with noise. People you didn't notice a moment ago are suddenly everywhere. You find the source. You try to fix it. For 11 minutes, you try everything you know. Your hands are steady. They're always steady. That's the cruelest part. Steady hands aren't always enough. The monitor flatlines at 10:47 in the morning. The room goes quiet. Not the quiet of before. A different kind. The kind that has weight to it. The kind that sits on your chest. You step back. You pull off your gloves. You drop them in the bin. There is nothing to say. There is nothing to do. You walk out. The family is in the waiting room. A woman in a gray cardigan. 2 teenage boys sitting on either side of her. She stands up the moment she sees your face. Families always know before you say a word. You sit down across from her. You use the careful language they trained you to use. Unexpected complication. Did everything possible. Deeply sorry for your loss. She doesn't cry right away. She just looks at you. Hands folded in her lap, very still. She asks one question. Did he suffer? You tell her no. You don't know if that's true, but you tell her no. You drive home that night in the wrong direction for 6 blocks before you notice. You sit in your driveway for 20 minutes without getting out of the car. Inside, your wife asks how your day was. You say fine. You eat dinner. You put your kids to bed. You lie in the dark beside her and stare at the ceiling. And you see it. The monitor. The flat green line. The room going quiet. You don't sleep. You go over the 3 seconds again. And again. And again. Every version ends the same way. The hospital's risk management team calls you the next morning. Then your department chief. Then a lawyer. Your own. One you've never needed before. They're calm. They're professional. They tell you this is standard procedure. A patient died unexpectedly. There will be a review. What they don't tell you, what nobody tells you until it's already done, is that every adverse action goes into a federal database. It follows you from state to state. New employers can access it. It never disappears. You didn't know that before. You do now. The hospital suspends your operating privileges while the process runs. You still come in. You still do rounds. But you stand at the edge of the OR and watch other surgeons work, and you feel something you don't have a word for. Not jealousy, something older than that, something closer to grief. The review board meets on a Wednesday. You wear your best suit. You sit at a long table and answer questions from people who were not in that room, who did not feel what you felt, who are reading about a 3-second decision from a report instead of living it from the inside. They are polite. They are thorough. They are, as far as you can tell, fair. The board can suspend your license. They can revoke it entirely. It has happened to surgeons with better records than yours. They don't. They find the decision you made was within accepted practice. They note a deviation in preoperative protocol, a checklist item that was skipped. Not by you. By a member of your team, they issue a formal reprimand to the hospital. They reinstate your privileges. Your lawyer shakes your hand. Your chief says good outcome. Your wife cries, the good kind, and you sit there and nod and accept the handshakes, and then you drive home and sit in the driveway again. You don't feel relieved. You feel like you got away with something. 3 separate doctors reviewed your case and reached the same conclusion. The board said you did nothing wrong. The lawyer said it's over, and still, the memories don't fade. That's what the research says, and the research is right. They sit just below the surface, vivid, permanent, the flat green line, the woman in the gray cardigan, the 2 boys on either side of her. Your resident stopped making eye contact in the hallways. You understand? You don't blame her. You go back to work. You see patients. You review charts. 1 month passes, then another. Nobody talks about it anymore. You talk about it every day, just not out loud. You go back into the OR on a Monday morning. 3 weeks after the reinstatement. You scrub your hands at the sink, warm water, soap, 3 minutes, the ritual. The thing that separates who you are from who you become inside. You dry off, you push through the door, cold, bright, quiet. Your resident hands you the scalpel. Your hand doesn't move. 4 seconds. They feel like 4 minutes. The team is watching. The monitor beeps steadily. Everything is exactly as it should be, and the part of you that used to simply go when it was time to go is not there anymore. Studies on surgeons who've lost patients show nearly 1 in 5 considers quitting entirely. You read that statistic years ago and didn't believe it. You believe it now. You take the scalpel. Your hand steadies. You begin. You are not the same surgeon who walked in here 14 years ago, or 6 months ago, or even last week. That surgeon believes something clean and simple. If you do everything right, the outcome will be right. You know better now. Between doing everything right and everything going right, there is a space, a gap, small enough to step over most days. Some days you fall in. It's a Tuesday afternoon, 3 months later. You tie the final knot. The patient is stable. Your resident says textbook. You pull off your gloves. You walk out of the OR, down the hallway, toward the parking lot. You pass the waiting room. A woman in a blue coat stands up when she sees a doctor coming. That look on her face, the one that means, please, please tell me something good. You stop. You tell her the procedure went well. You tell her he's in recovery. You tell her she can see him soon. Her shoulders drop an inch. She exhales. She says, thank you, like it means something. You walk to your car. You sit for a moment. Nobody teaches you how to carry it. You figure it out the same way you figured out everything else in this job. Slowly, imperfectly, by showing up anyway. You start the car. You drive home in the right direction. That's the whole victory. Some days, that's enough.